We recently published a report into mental health in prison with members of Nacro's Justice ExChange, who are a group of people who have been through our services at Nacro and want to give back and help and campaign for better justice services. While we were carrying out that research, we heard lots of stories around physical healthcare, and it was clear that there were other issues beyond mental health that the group of people we were working with really wanted us to look at. And as a result, once we published the mental health briefing, we did this research into physical healthcare in prisons. People in prison already have poorer health than the general population. In fact, people in prison are considered at old age 10 years before the wider population. And that's across a whole range of areas. For example, it can include long-term conditions, higher rates of infectious diseases, higher rates of mental health problems or substance misuse issues. So actually, being in prison is a real opportunity to tackle some of those health inequalities. The majority of people who are in prison will be released at some point, and ensuring that they can lead healthy and positive and productive lives is a really important factor in reducing reoffending in the future. Well, we surveyed more than 100 people who had recently been released from prison, and actually the results were really stark. And although it was only over 100 people, we think that's really representative of some of the issues that we're seeing across the prison estate in terms of healthcare. For example, almost half of people that we interviewed said they hadn't received the medical treatment that they needed from health professionals, and actually as a result of that, over half of those people said that they'd had continuous pain as a result, and 1 in 8 of those people also said they weren't able to work when they were released from prison as a result of that. So this has long-term impact, and it impacts on people's ability to move on after prison and to lead fulfilling and positive lives. We set out 3 areas where we would like to see improvement. The first of that is tackling the overuse of imprisonment, so ending the use of ineffective short sentences, for example. The second thing we've looked at is how to tackle the unhealthy prison environment. That includes recommendations about people getting time out of cell, that they're in purposeful activities such as education and work, and also improving their diet and their access to fresh air. And then the third area of improvement is around people's access to those health services in prison. And that includes things like looking at a review of the medication that's available to people, but it also includes how we look at inspections and how we ensure that the inspections that take place in prisons really drive improved services.